Sawadee and good afternoon once again. Today is Monday, the 9th of August 2021, and this is the English language summary of the daily press briefing here at the CCSA. So first, at the outset, I'd just like to inform you that for this week, and only for this week, we'll be having the briefing in Thai and English on Monday, Wednesday, and Friday, as on Thursday, we'll be celebrating the birthday anniversary of Her Majesty the Queen Mother. But next week onwards, per the current schedule, we'll be having the briefing on Mondays and Thursdays. So thank you to Dr. Pisamai for the Thai briefing just now. She highlighted some important issues. Just firstly about some hygienic measures which are very important to remind. For example, cleaning of surfaces is very important, including handrails and doorknobs, as well as restrooms, laboratories for sanitation. That's very important, especially when you have the elderly, old people with you at home. It's very important to observe the condition or any symptoms of the elderly that you live with, any elderly persons that you live with. Also, Dr. Pisamai talked about the home isolation and the community isolation, which I'll talk in further detail in a short while. But basically, if home isolation is something that does not work for some homes, meaning that when there are people who are positive with COVID and they have tried a home isolation, but it does not work because of the setup of the house or the overcrowded condition of the house. Therefore, that would be moved to the community isolation instead of the home isolation. Now, for the community isolation, of course, there is that hotline number 1330 in which people can call to inquire about the community isolation. Of course, community isolations are found throughout Bangkok and the surrounding areas, and there might be some near your homes, but they do not accept walk-in. You have to contact the number 1330. Another development recently is the setting up of various motorcycle riders to send medicine to those in home isolation. So I'll just start off with the vaccination progress that we have. The number of vaccines that have been administered since the start of our national vaccine drive. Just to inform that during the past week, we saw a new high in the inoculation rate with up to 670,000 doses administered to the general public in one day, in one of those new high days. Yesterday, we had, as you see on screen, 191 doses of vaccines, increasing the accumulated number of vaccination in Thailand to over 20 million doses. And you have the breakdown there of the first, second dose, and the third booster dose, which has begun for the priority groups. Now, information that would be interesting for the English language audience is about, of course, the vaccination progress for foreign residents. As announced earlier, as of today, a total of 46,100 foreign nationals from all age groups have registered already with the expatvac.consular.go.th platform set up by the Ministry of Foreign Affairs in collaboration with the Ministry of Public Health. So that had begun a few days ago, and we have up to 46,000 registered. As previously mentioned, all age groups can register for the first dose of vaccine via this website, but of course priority given to vulnerable groups. This is based on the same criteria as Thai nationals, which include elders, pregnant women, and those with underlying chronic diseases. Now, just a soft reminder that those who registered, foreign residents who registered, will be notified of the dates and vaccination sites in accordance with their level of risk and location of residence. So this continues. Now, another scheme which Dr. Pisamai mentioned just now was the one about foreign Thai students who have to travel abroad. Now, we have on screen, we announced this in Thai already in the Ministry of Foreign Affairs weekly press briefing. And we have the QR code there for Thai students who are planning to go study return to their studies abroad, both for those who are resident in Bangkok as well as in the other provinces. So you have the QR codes there and the instructions there on how to register for that. You can find this in the Facebook page of the Department of Disease Control, the DDC Facebook page of the Office of International Cooperation, DDC, for more information. So that's for the Thai students planning to travel abroad to continue their studies. So just quickly on the general situation and number of cases we have for today. We have actually today a high number of recoveries, which is about to level with the number of new confirmed cases. We have new confirmed cases at 19,603, as you see on screen. And out of this number, 313 are inmates from penitentiaries. We have a total of 214,421 active cases, meaning cases that are currently being treated at the moment in medical facilities. We have new recoveries at 19,819. As I mentioned, it's a similar number to the number of new cases that we have for today. New fatalities, 149, unfortunately. The fatality rate now stands at 0.84%. And as with the months past, Bangkok still sees the highest number of fatality, followed by surrounding provinces of Bangkok in the central region. Most fatalities are people at the age of 60 and over, so that remains to be true for those who are the elderly. The observations from the briefing, the meeting that we had this morning, is that for today we have Bangkok as the province with the highest number of infections for today, as shown on screen now. It's 3,114. However, the number of infections, the trend is moving towards stabilization. Though risk areas remain in the markets, in the factories, workers' camps, venues where large groups of people gather. And the number of fatalities and patients with critical condition remains high in Bangkok and adjacent provinces, mostly among those who have not received the vaccine or had received only one dose, or those who were in the elderly age group and chronic disease age group. And there's a total of 153 clusters in Bangkok under surveillance. More on home isolation and community isolation. For community isolation first, there will be a total of 67 locations in the Bangkok area with the capacity of 8,886 beds. This is for the community isolation. And 53 locations have been opened. We have another extra 14 locations which will be launched within this week. Now that was the community isolation. We have what we call the CI Plus as well. So it's the Community Isolation Plus, which now has 7 locations in Bangkok with a bed capacity of 1,036. Now CI Plus means that they are community isolation centers which have the capacity to take care of patients with more severe symptoms. So not the asymptomatic, but perhaps in the yellow group of patients who have more severe symptoms. Now, these venues will be able to accommodate patients what we call the medium level symptoms, and will also be better equipped with medical equipment to treat infected patients. Now, for the home isolation, as mentioned, home isolation for those who are found positive and do not have severe symptoms or are awaiting for their beds. Of course, when they contact with the hotline numbers, they will be provided with kits as well as medicines, as well as hospital care in terms of remote care. Now, there are 246 of these hospitals which care for homes with patients undergoing home isolation, and they have the capacity to cater up to 100,000 home isolation patients. So 246 hospitals responsible for overseeing home isolation, which will be able to cater up to 100,000 patients. And with the increasingly rising number of patients being treated in home isolation, as well as community isolation, the number of those infected with COVID-19 waiting for available beds at hospitals have also decreased. Now, a little bit about what Dr. Apisamai mentioned about the antigen test kit, or the ATK, that if you conduct the test, if you have the test, that's available to be bought already in Thailand. If you take the test, ATK, and it's tested positive, the patient can implement home isolation immediately. There's no need for another test for RT-PCR, and an order on this has been given by the Department of Medical Science, a directive on this. Dr. Apisamai also mentioned about a website in Thai, which is called koncovid.com, that has been updated to include on searching for community isolation locations. So it's a website to search for community isolation locations within Bangkok, and of course also where to find test venues. And that can be searched easily by postcode and locators on a map. So just a piece of information that's maybe of interest about the medicines. You may have seen in the news about the Favipiravir, which will be provided to all COVID-19 patients in Thailand. The Public Health Ministry will allow health units to administer Favipiravir to all groups of COVID patients, including those currently under home isolation and those in community isolation as well. So this is very good information to know, for you to know what we are doing in Thailand now. The ministry has decided to speed up and widen its coverage of administering the antiviral drug to all groups of patients in order to cope with the soaring new cases and fatalities. And according to the Ministry of Public Health, on August 14, the demand for the drug has risen to around 850,000 tablets per day. That's quite a high demand per day. Now, we have now 760,000 tablets distributed in Bangkok. The ministry has allocated almost 20.5 million tablets of the drug since July the 5th, and is planning to stockpile another 420 million tablets of this antiviral drug. The Government Pharmaceutical Organization, or GPO, is also set to procure 120 million more tablets between the month of August and September, in the month ahead, and an additional 300 million tablets between October to December to ensure a sufficient supply of the drug. So just before we end today's briefing, I'd just like to have you take a look at this infographic created by the World Health Organization on a very important issue: how to help children deal with stress during the pandemic. It underlines that children cope with stress in various ways, and we as adults must respond in supportive ways and show love and understanding as much as possible. We must listen to them and help them relax, while at the same time keep them close and inform them of the facts of what's going on in the country, in the world, in society, especially what they must do to keep themselves safe from the outbreak. So with that note, this is the information that I have for you for today. As mentioned, for this week, and only this week, we'll have it on Monday, Wednesday, and Friday, and we'll see you again later on this week. Please have a safe and pleasant Monday, and see you next time. Sawadee krap.